Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Day and welcome back to our Healthy Living edition of KUM News Extra with Dr. Jitka Lom. We're talking about antibiotics, and let's get to some of our viewer questions now. The first one comes from Janice from Mighty. Do I have to finish the course of antibiotics even though my child appears completely well?
You really do, and this is such a crucial, important question. The reason we need to finish the 7 to 10 days of antibiotics even though we feel better after 2 or 3 days is that we need to destroy all of the bacteria in our system. So if you're fighting a war and you only kill the weakest terrorists, you're going to be back in that war again pretty soon. So in this way, we need to destroy all of the bacteria. The strongest ones are the ones that are last to be killed. If you don't, if you finish only 4 or 5 days of the antibiotics, then you really risk that there are some leftover germs that will then become resistant to that antibiotic that you just finished giving them because they've seen that tool before. Next time you try amoxicillin, it won't work. And that's how we create antibiotic resistance, is if people don't finish their medication. And one final thing is that even though you're feeling better, you could be a carrier of that resistant germ and pass it to somebody else. So please do finish your full 7 to 10 days.
Definitely important. Now also Marlene from Jontya asks, can I save unused antibiotics for my child's next infection?
So this kind of goes back to the first question, is that you should have finished the antibiotics for the first time round. But if you have some left over for whatever reason, please check the expiration date. You certainly won't have enough to finish a full course though. So the answer is yes, you can start on that, but you're going to need to get a full prescription for your next infection.
So finish whatever the doctor gives you.
Finish it, please.
All right, Jackie from Santa Rita asks, I heard that garlic is a natural antibiotic. Is this true?
Well, garlic does help perhaps increase your resistance to infection, but it doesn't really help you kill bacteria. There are some natural herbs that can do that. One famous one is golden seal. Willow bark, I guess, is where they got penicillin from to start with. But these tea tree oil is also a retardant for bacteria. You can use that. And an interesting one is manuka honey. And in some hospitals, they do use honey as a dressing for wounds because it does actually destroy bacteria or at least retard their growth as a natural antibiotic. This is probably something you don't want to try at home, though.
That's interesting. I've never heard that, but that's a very specific type of honey that's probably not so readily
it's actually
available.
from New Zealand. It's because the bees eat this particular plant, and then the honey that they produce has natural antibiotic in it.
All right, so don't try that at home. Also, James from Manila writes, I am taking antibiotics which include penicillin. After 2 days of meds, I've broken out in a rash. Can I be allergic?
You might be, and that's also a very important question. There's a couple of things that could be going on there. First thing is, yes, you might be allergic, and people say, well, why didn't I break out on the first day? Well, because on the first day when you took that antibiotic, your immune system was not primed, so it did not recognize that new antibiotic. It took a couple of days to build antibodies, which then reacted against your antibiotic. The other thing is that you may be just having a side effect of the antibiotic, but not exactly an allergic reaction, just a side effect of a rash. And the third thing is that you may have a viral illness that has nothing to do with your antibiotics, and you're just breaking out in a rash just because you have a virus.
So as a follow-up then, how would somebody know if they're allergic?
Right. So if you're allergic, you typically will get a severe rash. It will be quite red. It might be very itchy. It will cover your entire body. We call that a drug rash, and it's easily recognized by somebody who's been trained. It's not just in one area, it's your whole body. And in very severe cases, antibiotics can cause a disease called Stevens-Johnson syndrome, where you actually break out in such a severe rash, including in your mouth and all your mucous membranes, that you can actually die from it.
Wow.
And it's very severe and life-threatening, typically caused by an antibiotic called Septra or Sulfa or Bactrim. Sulfa antibiotics can do that. So we must use them with caution.
So if somebody gets a full body rash, obviously stop taking the antibiotic?
Yeah, and give your doctor a call. Sometimes it's just the rash can be described over the phone and we can tell. Other times we have to look at the rash. But of course the most serious thing is if you take medication, you break out in a rash and you're also wheezing, having shortness of breath, you're definitely having an allergic reaction and you should stop your medicine.
Okay, one last quick question to throw in. Josh from Dededo asks, I am taking antibiotics for a urinary infection. Is it okay to take painkillers with antibiotics?
Most of the time, yes. If you're not allergic to the painkiller, you can take it along with it. In general, Tylenol or Motrin will not interact with most antibiotics, so you're safe there.
All right, thank you so much, Dr. Lom, for joining us. We
welcome.
appreciate it, keeping us healthy for sure. And Dr. Lom will be back next week to talk about lower back pain. So if you've got a question, make sure to post your question on KUAM.com or on our Facebook page. There is more health news when we return.